I'm Erik Campano in the Umeå Today newsroom on the University Arts Campus in central Umeå. The coronavirus crisis in Umeå has taken a serious turn. Many more people are being confirmed as infected with the virus. The hospital is beginning to have coronavirus patients again. And just over a week ago, the first patient in Västerbotten died in over 4 months from the virus. Regional and national officials have now set down major guidelines, which are intended to restrict human contact in order to slow the spread of the virus. With us via Zoom is Västerbotten Health Director Brita Winsa to explain exactly what doctors are seeing on the ground. Brita, thanks for being with us.
Hello.
Can you tell us a little bit more about what we know right now about the spread of the virus in Umeå?
Well, if we talk about the whole region of Västerbotten, we have a huge increase in the spread of the virus. So we have so many more people that are infected. I would say, fortunately, not all of them have serious disease, and they don't need to come to hospital. So but we do have patients in our wards now in all 3 hospitals actually, and I think I just an hour ago got a message that the first patient now is also in one intensive care unit in one of the hospitals.
Can you say which hospital they're in?
No, not really, because it's when it's very few patients, it's you can it's difficult. There's a risk that somebody can know who is the patient. So I would say no.
In the past, Lycksele has not seen many patients. But is there a concern that the commune of Lycksele is being hit harder now than it was before?
It is definitely harder, yes. So we have some patients in Lycksele Hospital, and there was also a cluster of patients as well as staff in one of in Storuman also. So there is now the western part of the county has not been affected earlier, but now it is.
An interesting statistic also, though, is that among the cities and towns in Västerbotten, Umeå is now significantly higher in terms of the number of found infections. Earlier, Skellefteå and Robertsfors were hit harder relative to Umeå. Mm-hmm. Can you explain why that's happening in Umeå now?
Well, we have a lot of more people living here, so that's one thing, and we are also testing so much more than before. So it also depends on how many people do actually take the test. Mm-hmm. So there are more inhabitants here, and we know that we have a spread among all people, but perhaps especially among younger people. I cannot really say anything about the students. There was a big test when the semester started, and then we noticed that there were very few who had the infection at that time. I wouldn't say that the students are the worst in spreading it. Not, absolutely not. We are all spreading it. Yeah.
Right. So the testing that's showing there's higher numbers of people infected, is that due, do you think, to just more testing, or is a higher proportion of the population actually infected?
Yeah, it's a higher proportion. So we are testing more, but we also have a bigger spread.
Do we have any sense of what that proportion might be? Any kind of numbers?
I don't have the figures here, fortunately, but there will be data, official data coming out soon. So, but I don't have it in my head right now. No.
We can tell our audience that the most recent figures from Region Västerbotten were that 835 people were confirmed infected in Umeå. That was as of yesterday after business hours. Let's talk a little bit about the restrictions that are in place. Our audience already has knowledge of that. We wrote about that yesterday. One of the restrictions is that people should avoid socializing. They should only meet with people they live with or a select few other people. Can you give us a little bit more specific detail on what's safe and what's not? For example, let's say somebody wants to have a dinner party with 8 guests. Is that dangerous? Should they avoid that?
Yeah, they should avoid that, actually, yes. Especially if the people are people you don't know. If you do it with your family and the people that you've met, that you meet constantly, then it's okay. Mm-hmm. But otherwise, it's difficult for all of us. We need to say no thank you to invitations, to nice social happenings. It's really not nice. It's so much against what's being a human is to be social. Most of us prefer being social. But that's not the appropriate way of living right now. We have to say no. So, but of course, especially people you don't know, don't meet them. And distance is the most important thing. 2 meters is safe. And I mean, nobody will spread anything if we are constantly 2 meters away from each other.
Okay.
And of course, seeing each other outdoors is also always much, much, much better.
The logic behind meeting only with people you regularly meet is that, correct me if I'm wrong, that if you were to spread it to them, it would have already happened. Whereas if you meet with new people, there's a chance that they might have the virus and spread it to you.
Right. Yeah, because some of us don't have any symptoms at all, but we have the infection, and some of us have very slight symptoms. So it's and also right now it's the fall. A lot of people have ordinary flus, like colds, and they are sneezing here and there and so on. Many of them are not. Most of them are not COVID.
Right.
But it might be, and you don't know until you've taken the test. So you can never be safe. You can spread before knowing it. So that's the difficulty.
Yeah. And finally, about their law, correct me if I'm wrong, but if I understand correctly, it's now illegal for, again, for people to plan gatherings of 50 people or more, for a public gathering of 50 people or more. Right. I guess it's for obvious reasons, right? Because large numbers of people can easily spread the infection. Are there consequences if this happens? Can people be fined or arrested if something like this happens?
I mean, I guess formally they can, but that's not the way it's going to be carried out. And there is one more thing, but people coming together. I would say that something that we've seen from the very beginning when we were talking about the spread in these after ski bars in Ischgl and Austria and also in Sweden in Åre. I think that being together, it might be dangerous, and if alcohol is included, it's even a higher risk that we don't keep the distance.
Right.
So don't drink together with a lot of people. Yeah.
Okay, so that's another guideline or recommendation.
Well, it's a recommendation from me because we've seen that, because there is a tendency when we drink, we become more social and perhaps we go closer and we forget about the restrictions.
Okay.
So keep that in mind, even if you have a glass of wine, I would say.
Yeah. Okay, and that's not necessarily coming from the region Västerbotten County officials, but it's coming from you and your expertise as a doctor.
Right, yeah.
That was we spoke with Västerbotten Health Director Brita Winsa. Brita, thanks so much for being with us on Umeå today.
Thank you.